Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A new and simple blood test has emerged that shows a 91% accuracy level in confirming Alzheimer's disease in patients with cognitive symptoms, according to the October 29, 2024 update on Medscape. Now, the blood test is known as the p-tau27, which is an indirect marker of the extent to which the brain is accumulating neurofibrillary tangles from the breakdown of its tau protein. Now, neurofibrillary tangles in the brain are a hallmark feature of Alzheimer's disease, which also promotes death of brain cells. Now, neurofibrillary tangles occur when the tau proteins that hold many key structural components together within brain cells break down and coalesce into these neurofibrillary tangles. Until recently, only MRI and PET scan images of the brain could identify the extent of neurofibrillary tangle accumulation, along with examining cerebral spinal fluid from the patient's spine. But with the advent of this new blood test, the p-tau17, a greater number of individuals can undergo early, simple, and very non-invasive detection for Alzheimer's disease. Now, this blood test will also likely be used to predict who's at risk for Alzheimer's disease in the future. So all of this is great, but what about preventing neurofibrillary tangle development in the first place? Well, the best research on this topic involves the ingestion of vitamin B3 in the form of nicotinamide. Yes, a vitamin B3 in the form of nicotinamide. As brilliantly outlined in the journal Neuroscience, nicotinamide is virtually the only known substance that prevents the breakdown of tau protein in the brain into neurofibrillary tangles. Now, animal studies have shown that in mice that are bred to be genetically prone to Alzheimer's disease, the administration of nicotinamide in their drinking water prevented the development of neurofibrillary tangles, and it restored cognitive deficits and it enhanced memory. The researchers concluded that not only can nicotinamide help prevent tau breakdown in the brain, but that preclinical trials suggest that nicotinamide supplementation should be considered as a safe adjunctive treatment in patients who are diagnosed with Alzheimer's disease right now to help slow further tau protein breakdown and help to prevent further brain cell death. Now, the first time that we had a hint that vitamin B3 could help prevent Alzheimer's disease was back in 2004 in the Rush Institute study, which followed over 6,000 Chicago residents aged 65 and older, whereby those with the highest ingestion of vitamin B3 showed a slower annual rate of cognitive decline and protection against Alzheimer's disease after controlling for age, the person's sex, race, education, and the well-known AP genetic risk factor for Alzheimer's disease. In other words, certain people, if they have this ApoE type 4 blood marker, we know they're at higher risk for Alzheimer's disease. But even in these cases, individuals, even with that genetic marker, who had higher niacin intake, or in the form of nicotinamide, had a lower risk of developing Alzheimer's. Now, since 2004, many studies have shown that niacin in the form of nicotinamide helps to stabilize tau protein in the brain, reducing the development of neurofibrillary tangles. And as reported in the Journal of Neuroscience in 2008, nicotinamide shows other effects on supporting the stability and viability of brain cells. Not only does it support the tau protein, but it supports other important proteins to keep brain cells alive and functional. In my view, a very wise thing to do each day is to take a high-potency multivitamin that contains a B50 complex, which would include 50 milligrams of vitamin B3 in the form of nicotinamide. Now, be sure that the vitamin B3 in your supplement is nicotinamide, not nicotinic acid, as only nicotinamide has been shown to provide these important tau-stabilizing, brain-protecting effects. So I've included the references for this information in the text below. Thanks for watching.